थोड़ा सा और। ठीक है, छोड़ो।
Yes, sir.
यस सर, बोलो बोलो, ठीक है।
Yes, sir. So I'm very happy to say that we are online on YouTube. So thanks a lot to all of my students here and the staff here. We could successfully do it, thankfully.
Thank you.
Yeah. Yes, sir. Kindly start.
I'll be talking on prospects and plan of action.
कुछ तो हो रहा है, ये क्या लिखा, ओरिएंटेशन ब्लॉक।
So, this is an international conference. So I look at international aging just to the aspect that the world can be divided into three categories: countries who is old, countries who
Excuse me, sir. We request you to be speaking a little loudly. Your voice is not audible. Sir, earlier it was better. It has reduced, unfortunately. If you could do something about it, sir. Could you hold it a little bit closer, the mic or the gadget?
Is it better now?
Yeah. Absolutely, sir. Very well. Kindly go on.
So, the developing nations can be people who would be able to defeat aging by gene therapy and reverse aging and all that. And there will be people who will be able to live gracefully with aging. And there are robots which help you to live gracefully with aging. And then, third category will be people who will suffer aging, who will need care. And India will have a substantial number of people who will need care. In fact, worldwide, as per my study, 12% of elderly above 65 will need care. And when you look at India, so in India, elderly is the fastest increasing group, and by 2050 it will be 20.8%. Number-wise, will be 35.3 crore by 2050. Presently, we are about 9% to 10%, so around 14 crore, but will be 35 crore by 2047. And 12% of these needing care means about 4 crore people will need care in 2047. And the other thing is, in India, the statewide variation is very high. Like Kerala, life expectancy even today is 75%, whereas Chhattisgarh is 65%. Then at life expectancy at age 60 is a good measure of the health of the state. So Jammu Kashmir at age 60 life expectancy is 21.6 years, Chhattisgarh is 15 years. Urban life expectancy is 4.7 years more than rural, because urban medical facilities are more. Now, NSSO says that 40% of the elderly have some disability or the other. So, for India, the transition time is short because France got 150 years to adapt from 10% elderly to 20% elderly. Whereas India will take only 20-25 years. Brazil, China, India, we have very little time. The other challenge is that our policies are more oriented towards demographic intent, and they cannot address the needs of the elderly. Even there is a tricky report which says that India does not have strong mechanisms in place to affect the issues of elderly care. Basically, our government and our people will treat the problem as a healthcare problem. What I am trying to say is, it's not a medical issue. It is just that the person cannot get up in the morning from the bed. So this is called frailty. So we have to look at the non-medical aspects of care. Like this model which has been made by Deloitte in 2014 on elder care. This only talks of health care. It does not talk of the care of people who are bedridden just because of debility, just because of frailty. Now that is going to be a significant percentage of people. Now long-term care is already a reality. In Japan, 12.6% of elderly receive care. about 10% at home and about 2.8% at institutions. In OECD countries, about 8% receive care at home and 4% institutions. So this is the 12% is a kind of a universal figure. So today in India, 85 lakh people need care, right? And by 2050, we'll have 353 million elderly. So care need is a reality already. Why? Because longevity is increasing. This maintenance of welfare of parents and senior citizens act has not really worked much. Joint families breaking down. The small nuclear families, they don't have. The informal care has kind of vanished. But it's coming down drastically. Work participation of women is increasing, which is good. So this care can be afforded, but not available. And public spaces are not made for the elderly, so elderly are not moving out. For whatever reason, the parks, roads, they are not elderly friendly. So elderly are not moving out, and elderly stay at home all the time. They will become further bedridden and unhealthy for them. And there is no fall prevention system at the residences and public places. You see, in Europe, the government gives 5,000 euros to everybody who turns 16 to make his house fall safe, so that he doesn't fall in his house. If the person doesn't fall, then the elderly can continue for a very long time. Then the elderly in India are not organized, it is abused, there is lack of trained manpower for elderly care, and there is no long-term care insurance system. That's a very major hurdle we are facing. Let's look at Japan, which is already 43% old. Now there, Japan, the gross population is falling. Elderly are 43%, but amongst them, 31% households are one-person households, 66% are women amongst them. 51% households have head of household who is more than 60. By 2025 this year, 25% of all Japanese will be above 75. And number of elderly has surpassed the number of children in 1997 itself. Number of marriages are falling in Japan, and people requiring long-term care, the number is going up. Japan is spending 3.7 trillion Japanese yen in last one decade on care of elderly. So this is a real issue. But Japan addressed it long back. In 1922, they had welfare policies for elderly. 1963, they made a law, welfare law for aged. 1973, they gave free medical care for the elderly. By 1980s, they made a law for promoting health care for elderly. 1994, they started the new Golden Plan, and 1997, the Long-Term Care Insurance Act came into being, and now they have a very good care insurance system. The long-term care insurance is contributed by the municipal authorities, by the local government, and by the national government also, federal government also. And the persons themselves also pay from the age of 40. So long-term care insurance, this is the way Japan is funding it. The individual, the elderly pays 25%. The individual from the age of 40 starts paying 25%. The premium comes from there. Central government gives 25%, and the state plus the municipal authority, they give 25%. That's how 98% of all elderly in Japan are covered, and about 16.8% receive long-term care benefit. The benefit which they got, they have to share 10 or 20% of the amount, balance the care insurance paid. So that is the beauty. So home elderly care services in Japan, they include home visits for care, home visits for nursing, home visits for bathing. If somebody cannot bathe, they will bathe you. Home visits for rehabilitation. Rehabilitation therapy is wonderful. It can do wonders for people. Management guidance for in-home care. Rental for medical equipment. If you need a wheelchair, they will get on rent, or other bed and all those things. Then community services, like daycare services, or short stay at the daycare center or it is a day-life services. And community-based daycare services are there where the person goes every day, he goes there, has a shower, they bathe him, they toilet him, and he eats there. All his activities of daily living, the support he gets, he does exercise, but he comes back to his home by the evening. So it's a daycare service. It's a beautiful concept which Japan has developed, and India can also think of it seriously. Now, institutional services for elderly, which they are giving in Japan. So, institutional service means not at home. So, there are special nursing homes for elderly. Then there are long-term care and health services facilities for elderly. And the last is the sanatorium type medical care facilities where people will stay till the end of their life, almost they will stay there. So, this is the institutional arrangement which Japan has developed. Now, care professionals which comes from this kind of economy, care assessors, home caregivers, care companions, homemakers, physical, occupational and speech therapists, social workers, dietitians, nurses, physicians, volunteers, and for institutions, the kind of institutions required are daycare centers, senior citizen home, Vanprastha ashram, senior family community housing, short stay home, respite care home, hospice or end of life care homes, palliative care home, abandoned people home, and religious ashrams. So these are the institutions which can and are providing care to the elderly. Now, what are the main cost components of old age homes? So we studied about 72 old age homes in Delhi NCR. So definitely, biggest cost is the cost of land. That cost, if the government can give land, then things can be much better. The biggest cost definitely is land, then the cost of building, then furniture, fixture, vehicle, ambulance. These are the fixed costs. Then operating cost is the maintenance and repair of the building, vehicle, furniture, generator, elevator, AMC, ROAMC, all those things, consumables, food, overhead costs, the taxes and all, property tax, all those things, park, fuel for generators, all those things, salary and wages of staff, and compliances which you have to do for CA and all those things. Healthcare cost is the main thing. Why people don't want to run old age home? Because if somebody falls sick, the cost immediately goes up so much. Who will bear it? Who will do the long-term care? That's why people are not very happy running old age homes. And miscellaneous costs. So basically, and I have found during my study that even charitable old age homes, people ultimately are not happy because I guess nobody is happy leaving his house and coming out. But that is the now reality, so people adjust to it, but they are not happy. So something has to be done more in this direction. Now we try to look at the monthly expenses of old age homes having 15 beds and 50 daycare, 50 beds and 50 daycare, 150 beds and 50 daycare. And the per person cost came to, for 15 beds and 50 daycare came to about 30,000 per person per month. For 50 beds, 50 daycare, it came to about 17,982 per person per month. 150 beds, 50 daycare came to about 12,493 per person per month. So this must be understood that when the scale becomes big, definitely the cost comes down. But in this cost, we have not included the cost of the building, the interest on the cost of building, the cost of land, these we have not included. So we must look at this also. Okay. So when I estimate the demand for caregivers for elderly, now middle class elderly they need care, so about 1.56 million demands come from there. The rural poor they also need care. So that solution I have suggested that for every 4 bedridden elderly, if we can give a caregiver from Manrega, then we can count about 14.7 million caregivers would be required. Then elderly who are confined to home, urban about 0.5, and this is data is available in NSSO. 0.58 million urban, 1.57 million rural. Then veteran elderly above 80, again data is available in NSSO is about 4.9 million. Frayed elderly means people who are above 85 and they cannot get up. That's the only problem. Otherwise, they are physically all right, but they are not able to look after themselves. Some activity of daily living they are not able to do. This number is about 3.98 million. So, if you look at 12% of elderly above 65, then India's data comes to 11.6 million. So, looking at all this, the total demand for elderly caregivers would vary from 3.98 million to 11.6 million for India. This is the demand I have estimated for India. So, about 40 lakh caregivers are required today. Now, I think we can make India into the care capital of the world. We can make caregiving into a respectable career with career progression, lifelong employment. When I talk of career progression, the progression can be from taking care of elderly patients to taking care of dementia, Alzheimer, diabetic elderly, cardio patients, things like that. And new fields can come like hospitals for elderly, nursing homes, hospice, these will also come. And we can have care jobs abroad. Just like Germany, for instance, is asking for Indians who can care for elderly, they must know German language B1 level. We have got demand from Italy, huge demand is there from Germany, from Europe, all over, Japan. They have listed. Nepal is one of the countries from where they are taking a lot of people. Indians can also go. Just have to learn Japanese B1 level. And I think this is the time when India should export caregivers, train and export caregivers so that they will see the world standards and when they come back, they will become the caregivers in India also. So I think like already Nepal, Indonesia, Philippines, they are supplying caregivers to the world. This is ultimately a referral job. Once one person goes, he is able to take so many people from India to that country. So we must not stay back in this, we must work very hard. And our domestic worker skill sector council and health sector skill sector councils and LBC International, they have made these programs, but they are not getting that many training partners who are seriously interested in this. So this work is not glamorous. That is the problem. We have not been able to make caregiving into a respectable career so far in India. So youths are also not very much attracted to it. But I say in every population, there is about 2.5%, 3% of gulas. Gula means people who are kind of innocent, who will not cheat anybody, but people kind of misuse them or they are pushed from corner to corner. So those kind of people we can pick up and train them to become caregivers. So they are basically caregiver people. So that's what we can do. And let's learn from OECD. So OECD families that became rich before getting old. We don't have personal wealth, but we have these golas. So and we can use the community care we can use. And basically what I have proposed that under MG Narega, for every 4 elderly in the rural area who are bedridden and who need care, male for male, female for female, if we can give a caregiver from the same village, then the rural elderly will be taken care of. So 70% of our elderly will be taken care of by MG Narega, 280 lakhs. For the urban labor class, whose parents have become old, there is this labor welfare cess fund, which is about 1 lakh crores. So we can make this an eligible item from labor welfare, this construction workers cess fund which is there. And if the construction workers' parents become old, he need not leave his job. For their care, the money will be provided from the construction workers cess fund. For 4 elderly, the one caregiver can be kept. Then third solution is we have long-term care insurance. once we have long-term care insurance at the age of 40, we will easily be able to take care of all our elderly by the time they become 65. So this is something which India must urgently start. Then fourth solution is paid caregivers, which already people have started doing care. So paid caregivers, those who can afford this. Today people are getting 15,000 to even 25,000, 30,000 rupees as caregivers. So that profession can work. So by 2047 we will be in 4 crore caregivers. So the solution will be 70% rural area. From MG Narega, where again 1 lakh crore is available. Then construction workers cess to take care of the parents of construction workers, long-term care insurance, and paid caregivers for those who can afford. So this is the solution I am proposing for our country. And I have made an 11-point action plan for long-term care facilities. Let me quickly go through this. First, in the census, we should make a list of houses which are working as old age homes and daycare centers. But as of now, there is no directory available of old age homes. There is no resource book, so nobody really knows. In census, we go door to door to see what is the use the house to be put. So all old age homes, daycare centers, we should be brought into this. Then as a profession, in census, we ask the person, what do you do? If a person is a formal caregiver or an informal caregiver of the elderly, that also we should include and bring it formally so that we know what is the number of caregivers already available in our country. Then second point is we should make an action plan to train and certify caregivers. Now family caregivers who are already giving care under the RPA category, recognition of prior learning category, they can easily by just 2 hours course we can make them to care. And one learning which I got was when we train a caregiver, we give him dual certificate. One is caregiver for elderly and second is general duty attendant or home health aide. So the benefit is that as long as the elderly is alive and fit, the caregiver can look after the elderly. If by chance the elderly passes away, then he can go to a nearby hospital and become a general duty attendant or a ward boy or a ward lady or a home health aide. So the dual certificate helps people to get jobs. So this is the second point. Third is we should allow, this is very important, because land is going to be so expensive. We should allow all NGOs having temples, churches, gurdwara, mosques to start old age home and daycare center. Maybe just 15 bedded, 20 bedded. In their own premises, we should allow them to do it. And we should do cross subsidy by giving them that much commercial floor area ratio. So, and free them from property tax. So, if I am living in, say, Malvinagar, and if within Malvinagar, if I can get in the temple in Malvinagar, if there is an old age home, or there is a daycare center where I can go every day, it will be beautiful. Then I don't have to think of shifting to an old age home. But if one has to shift also, then if there is a 15, that is 20-bedded old age home within Malvinagar, I would definitely love to go there. So if there is an old age home which is 50 kilometers away from my place, then all my social connects get destroyed. It is very difficult to live after that. So I think we should encourage the temples, gurdwara, church, mosque to build small old age homes within their premises and that much floor area ratio is there for commercial so that cross subsidy can happen. Secondly, we should allow change of land use policy. We should not charge people for starting old age home or daycare center in residential areas. Even if a house is vacant, we should allow elderly PG. When one elderly living alone brings in 4 more or 5 more and we live together. So elderly PG should be allowed. And primary schools are now, they have started closing because the number of children is going down. All the primary schools, government primary schools, sections which are closing, we should reserve them for daycare centers. First, we should start with daycare centers, and later, if required, we should make old age homes there. So that they are within the community, they are not very far from the place where people stay. Sixth point of action is we should make an action plan for healthy aging and make it a priority for every village, town, and city level so that care dependence can be avoided. Elderly should be allowed to join employment exchange till the age of 75. If elderly keep working till the age of 75, at least that much period they will be fit and healthy. And we should immediately start long-term care insurance in India. We can allow companies to pay for long-term care insurance of their employees or from CSR funds. Then next point is we should make elder mark or elderly friendly or elderly mode of goods, locations and public spaces and services. जैसे basically elder mark का मतलब the product is fit for elderly, it is elderly friendly. So there is a huge silver economy coming. So we should be able to mark products which are elderly friendly and useful for elderly. Then we should look at the silver economy and we should give IT rebate to all elderly of 1 lakh rupees to make their home all safe. At least this we can do so that people make their home all safe. And we should include caregiving of 4 elderly daily as a mandate as an MG Narega for rural areas. And physiotherapy of 8 elderly should also be covered under MG Narega. Because without physiotherapy, if you have an injury or something, you cannot recover. So this is very, very important. And even for the disabled, I think, for looking after 4 disabled, you should allow under Manrega. And finally, the mobile company should be given a follow-up service for elderly to remind them for their medicine, chat service for somebody to talk to them about their loneliness, about abuse, about the emergency service. So all those things the mobile company should seriously think of it so that they can give a helpline in case of emergency. In Italy, I found this, that there is a button if you press on your mobile. A call goes to your nearest relative. If the relative does not answer, then the call goes to the primary health center. Then the ambulance gets active. So that's the kind of system we will have to develop one day. Last is the action plan for healthy aging. So we must have information, education and communication plans for the elderly. We must have daycare centers where yoga is available, regular healthcare checkup is available, active and daily helpline should be there, old age club should be there, walkable paths for morning, evening walk should be there. We must develop elderly friendly parks and public spaces. We must have physical fitness programs for elderly, nutrition counseling for elderly. We must prevent osteoporosis and other age-related diseases. There are so many vaccines which have come for elderly. So our country will have to think of making generic vaccines for elderly, for age-related issues, provided to public, and social capital contact generation, and the public RWA NGOs participation should be encouraged in elderly affairs. So this is all I wanted to say. I'm grateful to IIT Jabalpur for giving me this opportunity. I hope I have been able to add some value in this conference.
Yeah.
Any questions I would like to answer? Thank you.
Thank you very much, sir.
Any questions?
This was a very important talk because yesterday we were discussing problems. Are you able to hear me, sir? Hello? Are you able to hear me, sir?
Yes, yes.
Yeah. I'm very thankful, sir. This is a very important talk because yesterday in the conference we were talking about problems. You have given us the solutions. And now the task of taking care of the elderly looks very much possible. And
Yes.
this is very convincing. The way you have talked about, India becoming a care capital of the world is a very, very innovative thought. And I really feel India should become a care capital of the world. And that is how we should be a nation leading the world. So that's a wonderful talk, sir, from you. any participants there online who have any questions, or the people who are present offline, if you want to ask anything, please ask. Any questions over there?
No, ma'am, it was wonderful.
Yeah. There is Manjari Agnihotri wants to ask something.
No, ma'am.
Okay. Okay.
Okay, thank you, ma'am. Thank you, everybody. I hope I have been able to give some value to you. And God, I hope ultimately we will to do something for the country today.
Sir, we are very thankful. You had such wonderful ideas. This is a program that India would have to follow.
Yeah, I have been Secretary Social Welfare, so I understand a little bit of all these things. So that's how I put it together. Thank you so
So
much.
we are looking forward to a tie-up with you, sir, for
Thank you.
things.
Okay.
We'll be very grateful if you do it. Thank you very much, sir.
Okay.
Yeah.
God bless you.
Thank you,
So
sir.
I'm leaving now.
Thank you very much, sir.
Okay.
Thank you. So I request all the participants, we'll be now starting with the